All this is Dr. Mobeen Sayed from drbeen.com. Welcome to the third show for today. I cannot believe it. We are now doing 3 shows in one day. Welcome to the third show today, a random chit chat. Let's ask our questions and discuss them. Welcome, and hope everybody is fine. So Steve is first today. Yes, Steve. Uno, yes. Jenna is there. Jenna, I hope you're doing fine. Please tell us how you're doing. DDS, hi. Carolyn, hello. Carolyn, it was fun to hear that your son has been listening from the other room as well and liked it. So that was great feedback. Ruby's first, don't forget to hit the like button. Yes. Margaret, hello, how are you doing? I love the tree that Margaret makes. Nancy, welcome. Ali G, welcome. Mercy Turner, greetings again. Cool beans. Anna Strange, hello. And Diaz, good job, thank you. Yeah, good job, Steve. Ali G, my wife's heart's right bundle branch is blocked. Is it safe for her to take that AstraZeneca? Yes, so look, as long as these things are in control, the problem with vaccines can be, in case of their side effects, there can be pressure on cardiovascular system, on respiratory system, on the body in general. So if somebody cannot handle a cardiovascular extra demand because of inflammatory processes, because of, let's say, fever or myalgia or low blood pressures or just, let's say, thrombocytopenia and putting demands on the system, then there is a problem. But most of the time, these things are controlled and patient is stable, and then they can take vaccine as well. And as you know, the right answer is to speak with your doctor as well. They know her history, they would know her stability, and that is how they would then decide. So tell me this: how was the talk? How was the talk? Was it useful, or did I demolish your 1 hour? Marco says, I received Moderna 5 days ago and I developed small bruises. Should I be concerned? So these bruises are local area or throughout the body? It has been known that Moderna can cause local rashes, but please do talk with them. And they must have given you some sort of a number to say, if you have any issue, please talk with us. So do talk with them, maybe send them a picture of this. And if it is body wide, and that would be more concerning, and please do talk with them. Anna says, extremely valuable, good to know. Steve says, I'm using an iPad, very nice. Chuck says, very, very good, thank you. LD says, hi again, 33 on like button, 120 watching, 134 now. Guys, hit the like button. That is the least you can do for me. Diversity says, I learned a lot. Thank you. India multi-mutant variant. Yes, so there is a news about the multi-mutant variant, and I read that. One of our cool beans sent it to me as well in WhatsApp too. I have to look at the mutations. Double mutation or double mutant, meaning accumulating the mutation, that may be happening in many areas. The question is, what are the changes and what is the effect of it? And maybe let me make this comment as well. I'm seeing a lot of one-trick ponies who are picking up this mutation thing and kind of trying to scare people and saying that, all right, we are doomed, and we will be doomed when there is a SARS-CoV-3 setup. When we'll come up and we'll say, you know what, we have a SARS-CoV-3. Everybody else who was infected before is in the same boat now. Imagine you guys never had infection before and you're once again open to it. Till that time, we have variants. Our bodies will be able to work with it. Unfortunately, this concept that has been made popular by some folks recently, that somehow if you are vaccinated, your body is going to become weaker to respond to a mutational virus, that is a flawed concept and is causing a lot of fear. and concern. And when somebody is concerned and when somebody is fearful, then asking them not to be fearful without explaining the things becomes a problem. Just like so many folks had been saying to me that the vaccine is going to end up in blood and then we are in trouble. And as you could see, that once you understand the mechanisms and once you understand the concepts, it becomes easier for you to figure out how concerned you should be. So it's just unfortunate that at this time that fear mongering is happening. Let's do this. Let's keep an eye on these things together. Ideally, there should be a group of cool beans, sort of a board, who should vet what topics are concerning enough that we should talk about them and what topics can just stay aside. And that way we can then decide that nothing that is concerning is left out. Okay, so let's see. Questions. HI says, do you think we'll have COVID-3 soon? So look, we had SARS-CoV-1 and now we have SARS-CoV-2. So that means if we have SARS-CoV-2, we might end up with the SARS-CoV-3 as well. The second thing is that SARS-CoV-2 is going through our society, but it has what, 500,000, 500,000 infections so far. We are 7 billion people. So it has a lots of people to go through and learn and mutate. Will it become SARS-CoV-3 during that process? I can't say. SARS-CoV-2 has not changed significantly enough to become a new virus. It has changed enough to let's say, escape here and there or reduce the efficacy, but it is still the same virus. And as I have been saying last year, if this virus has to really change, it has to change its binding to something else, or it has to change its envelope to something else, or its end proteins or others. Otherwise, our body is going to attack it. If we know it, we are going to attack it, even if it is a part of it. So my thinking is we will not end up in a SARS-CoV-3 situation, and we would have handled the pandemic before then. But that may be optimistic. Maybe I have that switch on to stay positive and not become scared and not make people scared. So, Mr. J, again, if that happens, then we should worry. We are not at that stage. Chuck Becker says, I learned this tonight. I shall speak up right before the jab to tactfully remind them to aspirate and push the fluid. And yes, there is nothing bad in doing that, other than aspirating and then doing it can cause their hand shake, and that might create a little bit of a pain. But if you are concerned, then instead of thinking afterwards that, am I going to get thrombosis tomorrow or day after, or this headache which I got, is it thrombosis? Instead of that, you can actually say, hey, please, I'm okay to take this pain, aspirate and see, and then inject. Mr. J says, if someone is reinfected with a new variant, isn't it possible it isn't a new infection, but it mutated inside of them, making the next test show a new variant? It is possible that a person would have variants develop in them. But for that, number one, we have talked about it before as well. Every time this virus or any other virus replicates, it does make babies that are different from it. There are mutations. Some of the babies are not able to continue their life because their spikes are not correct, or their RNA is not correct, or their end protein or matrix or other proteins are not good. So they just die there. Some of them are much more aggressive. They say, you know what, I am going to bind with more affinity and I'm going to really destroy the cell fast and I'm going to do something more. And the problem is, if that happens and they spread in the same person, they're going to kill him. And so from him to others, their path becomes less possible. So the best path for these things is to adapt to us, make us less sick, and then get out as well. I know many folks then respond to me and they say, well, you know, that silent time window during which they are able to shed and still not be known to the person that he is sick. So please realize that when a virus is more infectious, more contagious, it would cause disease fast as well. It's not just going to be more lethal but then sit there to count the number of days to 5 days. Now it's going to be causing harm fast. And instead of 5 days, it's going to cause the person to become sick in 2 days. So the person's exposure is going to compress as well. So there is a balance in the whole thing. Problem is, this is a virus that has never been in our bodies before. So it has a chance to just keep propagating. Sapele Steve says, a research group in Denmark is developing a vaccine that is made up of the peptides of the ACE2 receptors, allowing the virus to attach to it rather than the cell's ACE2 receptor thoughts. Very good. So we have a Dr. Alexander Vasaras from Greece. Sometimes he joins us here. A year ago, and I have his notes, a year ago he had sent a note and he wrote the comment here as well, to say, why not we just develop ACE2 receptors and inject them and allow the virus to attach to them, and now the virus can't do anything. So yes, that is a possible solution. And I then sent a link back to Dr. Vasaras that there were some companies that were trying to do it as well. So this is a good idea, not bad. Now I wanted to show you this. Somebody said that, hey, Pfizer is coming up with a pill. So let me show something very funny about that. I'm going to share my screen. You would actually enjoy that. So if I say here, Pfizer COVID pill, and if I go to the hill here, or whatever the first one, check this out. You would actually, if you be, oh, I hate this, sorry. So check this out. Pharmaceutical giant Pfizer has kicked off early stage clinical trials of an experimental oral antiviral drug to treat COVID-19. The company announced on Tuesday the phase 1 trial in the US. And check this out. The treatment is a potent protease inhibitor. Potent protease inhibitor. Do you remember, Cool Beans, that we've been talking about protease inhibitors for some time? We talked about TMPRSS2, which was bromhexin and other things, chemostat mesylate. Then within the cell, we know that this virus can, this virus, when it comes in, it has RDRP, and then it has 3 chymotrypsin-like, does it ring a bell? 3 chymotrypsin-like protease, right? And guess what did we talk about? What can block this? Ivermectin. So what are they doing? They are making another ivermectin, partial ivermectin, not even the whole ivermectin. But I think they're going to sell that for much more than ivermectin, because ivermectin can block this guy, it can block this guy, it can kind of hinder the binding here, it can hinder the importin alpha and beta, it can hinder the NFK beta pathway, and they are making this. Or they are making TMPRSS2 blocker. So we know TMPRSS2 blockers like bromhexin or the chemostat are already there. And we know that ivermectin is already there. Why are they making this new one? The treatment is a potent protease inhibitor, the same kind of technology used to treat HIV and hepatitis C. See, this is how big companies work. They already connected it, the same kind of thing that is there to treat hepatitis and HIV, and you say, oh man, this must be great. And the concept is changed. When it comes to talk about ivermectin, the poor thing, or hydroxy, the poor things are just, spat on. And here, when they're talking about a similar thing, they are just already building brand for it. Protease inhibitors bind to viral enzymes and prevent the virus from replicating in the cell. Well, we know that. The 3-chymotrypsin-like protease, ivermectin does it. RDRP binder, ivermectin does it. There are others as well. So anyways, it was just funny for me to see how business is going on as well. Yes, Machiavelli, correct. So what they did was they said, why not we make a molecule that does the same thing, but just name it different. And it's a new molecule from us, and it's an antiviral from us. And all of a sudden they have a new drug. So logic, have I still not been able to explain this? Can you explain why a vaccine might cause thrombocytopenia and neutropenia? Are there any conditions that would increase the risk of this? I think I just explained it, that the vaccine can cause thrombocytopenia by activating the thrombocytes, by creating the antibodies that would attach with the thrombocytoplatelets and activate them. That would cause thrombosis, which would then result in thrombocytopenia if it continues to happen. Now, what conditions can cause this? For this, you don't have to have an underlying condition. If the vaccine makes an antibody that is going to do this to somebody's platelets, then you don't have to have other conditions. You may have an inkling if you ever got heparin and heparin caused thrombosis instead of thinning, then you may know that I may have such a chance, but that is a different phenomena. This is a different phenomena. Can we predict it? No, at least not yet. Maybe people would find some genes and some technologies that would show it. Logic, I hope that answers. So no worries. Maybe the difference between you and me right now is that I said platelets. These are the thrombocytes. So when you talk about thrombocytopenia and when I talk about platelets aggregation and reduction, that is what it is. Carol says, I said months ago they would make a designer drug, sick profit. Yes. So they just took part of ivermectin, or they just took bromhexin. And they said, fine, we'll just make it and we'll give it a new name and we'll make it shiny and beautiful and now we'll sell it. And here we are, the whole world sitting saying, just give us ivermectin, we're happy with that, leave us alone. And they are just continuing to do what they want. So Steve says Pfizer, Moderna, ivermectin. It is, Steve, still a task that I have to do. I still have to work on it. I'm trying to do all these talks. I've made it into 3 talks, but still there are so many topics. It almost seems like every 1 hour we should do a talk and keep talking and answering these things. Sapele Steve is saying the right thing. Hit the button and smash the bell. Luffy will be happy. Yes. Jody, question. Septal defect at birth, since closed, periodic arrhythmias, murmurs on ITP, will not see doctor until pandemic finished. Vaccine or COVID more dangerous for me? So I'm going to answer whatever I can understand from this. Septal defect since birth, and let's say you are not affected by it, then I would think it is something like atrial septal defect. And if you're not affected by it, no big deal. And if you just saw my previous talk, you could actually see that vaccine going in vein, and then going all the way to the heart and then crossing over through the septal defect to the other side and then going to the brain and causing this is almost impossible. I'm being a doctor and scientist, I can't say 100%, but it is very difficult for us to inject vaccine in a vein and then it goes all the way to the brain and does not stop anywhere on the way. It does not stick to the vein itself. It does not stick to the heart itself. It crosses the septal defect, goes up. That's one answer. Second part of the answer is, if it is a ventricular septal defect, then you have to be at that stage where the right heart has become stronger than the left heart. And it is throwing blood from right to left. which would create so many other issues that you would not be talking about vaccines and those things. So if you are not bothered by that, I would feel that you are healthier. And you're saying since closed. Then periodic arrhythmias. Arrhythmias are of three types, but let's use the main two types. The suprajunctional arrhythmias or atrial arrhythmias, and then infrajunctional. I'm going to leave the junctional. So depends upon what is the type of arrhythmia. If it is suprajunctional arrhythmia, then what? Atrias do arrhythmias all the time and we are okay. Not all the time in everyone, but in many people they do it and we are okay. Ventricular arrhythmias can be problem. So if somebody has ventricular arrhythmias, bundle branch issues, or Wolff-Parkinson's issues, then we have to be careful to see what can happen when the system is under load. So then you have to be careful. Murmur and ITP. Is that ITP idiopathic thrombocytopenic purpura? Murmur, again, is that the defect murmur from septal defect? Or if that is closed, is there a murmur from a valve? So even if there is a murmur from a valve, the question is how worst. If the heart cannot take load, let's say you get the vaccine and vaccine causes some side effects. Part of that is now the heart cardiovascular system is under stress. And if the cardiovascular system cannot take that stress, then you are in trouble. So again, how much of a problem, I don't even know. COVID can be really dangerous. Vaccine is still less symptomatic and causes less side effects than COVID. COVID can put a lot of load in the body. Okay, so Bambi, how are you? We've been doing morning discussions that probably are evening in UK. I haven't seen you. Are you aware that we have been talking in the UK time, a better UK time? So Bambi Secret, Dr. Bean likes this question. Should I insist on aspiration given my left arm uses USS left arm December 19 showed my veins are in the wrong place, was told a SNR radiographer should perform USS prior to future lines. Yes, so please ask them. What is the bad thing in this? Maybe slightly more pain because their fingers might shake as they're trying to aspirate. Or if they have aspirated and there is blood, they're going to move the needle. But that is all good if you can just take that tiny bit of discomfort. So yes, if you're concerned, ask them. Instead of getting the vaccine, then thinking for the next 20 days that would I get it or not, and every headache would look like I have thrombocytosis, I would rather take that temporary pain. Denise is saying I had supraventricular tachycardia post-COVID. Yeah. Supraventricular tachycardias are many times easier to handle. One can even ignore them. Atria, sometimes they need correction. But it is the ventricular tachycardia that is much, much worse. Supraventricular can cause issues too. I don't mean to minimize them. Nick says, question, should I be worried about crowds if I have been vaccinated and wear a mask? So I'll give you two answers. If you are vaccinated and your vaccination has become completed and you are in that protection zone, then ideally you're fine. You go out in crowd or you don't go out in crowd, doesn't matter. Same is true for the mask as well, that if you have gotten vaccinated, then mask is not needed in theory. Now, the second part of the answer. If there is a variant that still has a chance to affect you and maybe the efficacy of the vaccine is lower and variant can make you sick, then having that distance and mask is useful. So if I was the one, I would try to avoid what I can, but I will not be too worried. That is for me. Mask is one more. It's a social aspect. It has a social aspect to it as well. That are you how much you care for others. They don't know that you have gotten the vaccine or not, you need the mask or not. So that is another aspect. TD, very good. Nick says, thank you for your answer. You're very welcome. Sapele says, hit the like button. Yes. Simple Garden is doing some talk with someone. France. I'm a teacher who got COVID at school. I don't think 3 feet is enough. I don't think 3 feet is enough. I don't know why did they change it to 3 feet. It seems so ridiculous. Even 6 feet is something that one can question. Josh says, question, my family carries factor 4, factor 5, and have had blood clots in the past. Is Pfizer safe? Can blood clots occur, or can adverse events like hypocoagulability happen? Should they take aspirin before vaccine? Josh, these are all good questions for your doctor. From the general point of view, these vaccines, for example, Pfizer, we haven't looked at those data. So as I said in my last talk, I haven't looked at that data to be able to say, yes, they do not cause it and AstraZeneca is causing it, or I should use the right word, is associated with it. So without seeing that, I cannot say it, Josh. So it would be bad on my end. Let me, every morning when I wake up, I say, today I will do a comparison of the vaccines. And then here we are. Every day there is a different topic that we talk. So give me a day or so, but do talk with your doctor. If there is a propensity for clotting, then it will be interesting to use something that would prevent clotting or reduce clotting. Curious says, can my daughter, 31-year-old with pseudomotor cerebri and autoimmune hepatitis and autoimmune biliary cirrhosis, take a vaccine? So, general answer. And I talked about it yesterday as well. So as far as the mental or neurological symptoms are concerned, not a big issue. For the liver, depends how badly the liver is impacted. Usually, for liver's job is to detoxify and to clean out the drugs and the food. Vaccine has nothing to do with liver. So vaccine can be given separately and it would train the immune system and move on its path. Vaccine does not need liver to activate it. It does not need liver to metabolize it or remove it or clear it. Our immune system takes care of the vaccine. So from these points of view, these issues are not a big problem. But of course, I do not know the intensity. I do not know the history. I am not her doctor. So the best is to talk with the doctor. General, in theory, these things should not be an issue. Texas Max says, question, any OTC to stave off possible vax clotting aspirin? Yes, aspirin. The most important one is aspirin. Doug says, cough like a smoker. There is a side discussion going on. Kathy says, question, Dr. Bean, with all the issues involving EMA vaccines thus far, would it make sense to just wait for Novavax? So when I say that I'm not a fan of AstraZeneca, people send me comments that somehow I am not a fan of UK technologies, or I am not a fan of AstraZeneca for all of the things that we keep seeing. So maybe it is media, European media going bad about UK's technology and US media doesn't like it. I feel it shouldn't be that way, but the news is there. So I love Novavax, but if they said there is no other vaccine, AstraZeneca is the only vaccine. Now, do you want to have COVID or do you want to have vaccine? I will take vaccine and I will take AstraZeneca. William Goff. So, William, I hope you're doing well. I'm seeing a decent amount of reports on VERS for myocarditis and pericarditis. How can a vaccine cause this? Simple. Just like we talked about thrombosis, a vaccine can cause antibodies that can go and attach to various tissues in the body and then cause inflammation of those tissues. Interesting, TD. Cool. So how about we break for today? There is a question here, building maker. Dr. Bean, did you see Israeli labor court ruled you can be fired from your job for not getting the jab? It will no doubt be appealed. So I think that is as much as there is a freedom to refuse the vaccine, I think on the employer side, it is also a responsibility for them to make sure that the environment is safe for others too. Now, can they not ask them to work from home? Do they have to fire them? That is what I have. So again, if the court said it, then court must have looked at their local laws and regulations. I just feel that if somebody doesn't want it, we should have some solutions for them as well. Ivermectin, vitamin D, something. Even if, let's say, these are all placebo, even then, do something. And then who can take vaccines should take vaccines as well. Arun says, Arun, I've seen you after a long time. What is man? I didn't get your question, Arun. John Snyder of France? Texas says, need more laughs. I love Lexotanil, but again, I think that is a not over-the-counter drug. William says, thanks for checking for me. I'm finally starting to improve. Very good. So hopefully you would be fine in another week or so. Good for you. Yeah, John is not here today. Japan has not been here for a long time as well. Pasi has not been here for some days. I hope I've not offended folks to then say, okay, bye. Oh, wow. David says, my doctor wants me to double my current dose of ivermectin to 900 microgram per day. Is that a safe dose? 900 microgram per total or 900 microgram per kilogram. So if it is total 900 microgram, which is, are you talking about 9 milligram? For a 70 kilogram person, 12 milligram is the right dose. So anything lesser than that is kind of subpar. The basic calculation is 0.15, and I'm using the lower end of the therapeutic dose, 0.15 milligram per kilogram or 150 microgram per kilogram of body weight. Thank you very much. Franz said, I said yes out loud when Dr. Bean asked. Thank you very much for saying it. William Gov, I still do not know if I'll be taking the second shot, lol, but I am finally improving. Kitty says, can you talk about lost smell and taste? Kitty, I did a video about that about a few months ago. So if you can look up, I think it was loss of smell or something, anosmia. I've discussed how the inflammation in the olfactory area causes this. Cool. So thank you very much for today. Thank you for being here. We'll continue our discussion tomorrow. I hope you liked the previous discussion. As you can tell, I'm pretty proud of it because I wanted to allay that fear. So I think whenever I can remove a fear, I feel happy. So thank you very much for your time. Please like, subscribe, and share. And if you would like to support this work, in the description, there are 3 links. One is if you would like to buy me a coffee, and other one is for Patreon, and there is one more for supporting this work in general. So thank you very much. I saw a question here. Let me see if I can answer this. James Melis, so you're going to get me in trouble here. What is your view on gun control? Doug Gross, maybe it's too soon to go off topic from COVID-19. Is it? We can, meaning stay on COVID-19. I thought these couple of days, like diabetes or other things, can add some more flavor to the discussions and reduce that boredom that comes with continuously just talking about COVID. But whatever way Cool Beans would like. So I'm going to reserve my comments about gun control. Rima is saying that please check your messages. So Rima, I would check that out. Let me do that after the video. Curious says yes, too soon. So we can stay on these things. Renee says, did you notice that the CDC changed its definition of herd immunity to only include immunity from vaccine? Really? Really, Renee, is that true? Then people become so upset with me that you laugh. Somebody had said you were a giggling mess. So these things make me giggle as well, as much as they make me cry, because they're just so silly to do. Herd immunities. That's just so silly. Cool. So there is a question from Colin. When getting a vaccine done in the right place is so important, does it mean Bill Gates' idea of breeding mosquitoes to vaccinate could kill if they got you in the neck? No. So the mosquito is going to inject a hugely small amount. Nothing is going to happen with that. They can bite wherever they want. And their usual bite is not even in the blood artery. They actually just bite and drain from blood, capillaries like thin vessels. So no issues. Cool. So Rima, yes, that made people very mad about me. They still send me curses and insults. Okay, cool. So thank you very much, and I would see you tomorrow. Bye-bye.